Thank you. I'll be speaking about the linkages between agriculture and nutrition in India in the next 8 minutes. Also, lessons to be learned from this experience. India is an odd man out, as Derek mentioned. Across countries, India is growing at 8 to 9% for last 5-6 years, and also earlier it was 6 to 7% since the early 90s. But the reduction in malnutrition is very marginal. So there is a puzzle. So this puzzle leads to maybe other factors are important, maybe health, women's well-being, and other things. But one part of the puzzle is that in the role of agriculture sector, because in India, the share of agriculture in GDP is only 15%, but the share of employment in agriculture is 56%. So the livelihoods are dependent on agriculture. So what is the impact of this agriculture on nutrition is one of the important topics, and not much has been done. And IFPRI project recently done, also Derek mentioned, is tries to fill this gap. The objective is that the agriculture initiatives alone cannot reduce malnutrition, but it can play a much bigger role than the present. In a vast country like India, even the states may not represent. It's difficult to look at only states are also very big, like many other countries. So one has to probably look at even at the district level. Somebody said if you look at district level, maybe this disconnect is not there between agriculture and malnutrition. Agriculture growth is about 2% to 2.5%, but across state it varies. Some are higher, 4% and thing. But the relationship shows that there is disconnect even between agriculture and malnutrition across states. But there is, if you see across states where agriculture productivity is high, like in Punjab and other states, the malnutrition has declined. And where agriculture growth is lower or productivity lower, like Madhya Pradesh or the eastern and central parts where malnutrition is high, there probably agriculture growth can improve the nutrition levels. India, as mentioned by Prime Minister yesterday and also others, that we are focusing on how to reduce this malnutrition. First, of course, agriculture policies, we are focusing on small and marginal farmers and resource poor, rain-fed agriculture, and also some of the policies on also marketing, agriculture marketing, because people are producing, but they're not getting income. For example, if you take tomatoes, the farmers get 1 rupee, but we buy in Delhi 40 rupees or so. So some kind of marketing problems are also there. And then on health factors, the public health service are have to be improved in India because we have low levels of health indicators and slow progress in health also. Yesterday, Prime Minister also mentioned National Health Mission, which can improve, hopefully, the health indicators. And this other thing is the women empowerment, because this is an important factor for nutrition levels. The difference between South Asia and the African malnutrition levels, because South Asian levels are double to that of African levels. So what are the factors? Literature has shown that it's the women's well-being is one of the important factors, apart from other factors. So gender factor is very important. We have many programs for that. Now women's empowerment is increasing. And also lastly, India has many programs, like Derek mentioned, the nutrition programs. We have, yesterday I talked about the National Rural Employment Guarantee Scheme, how we have the public distribution system and the nutrition programs like ICDS, Integrated Child Development Services, midday meal schemes for a long time. But there are some lessons that can be learned from these programs, because impact of NREGA, the National Rural Employment Guarantee Scheme, yesterday I gave a presentation. it has some positive impact on nutrition levels through three pathways. One is the income effect, and the other impact on women, and also direct effects on children thing. So the evidence shows that this program is a lifeline for the poor. 68% of the participants said that it has reduced the hunger in this program, and also improved the help to cope with illness also. And thirdly, also they mentioned that it helped in sending the children to school. So in other words, it's a also agriculture wages have increased, which have helped the diversifying their diets, because earlier the agriculture wages were 30 to 40 rupees in several parts of India. Now there are more than 100 rupees in several parts of India. So that has improved the incomes of the agriculture people. And also it has probably impact on agriculture productivity also, because these works can be done in small and marginal farmers, and then it can improve the productivity of these small and marginal farmers. One of the important things in this program offers lessons is that accountability. How do you do accountability of this program? One is the social audit, which is an instrument for accountability. I have given in another paper. The Andhra Pradesh experience shows that the social audit played an important role for accountability of these programs, which can be used for other programs, food security programs. Even other countries can learn from this social audit. And on the other programs, India has ICDS for a long time, since 1975, but the malnutrition levels have not increased significantly as compared to these programs. And to conclude, these programs and also agriculture have done well in some of the states as compared to some others, like Tamil Nadu Nutrition Scheme mentioned by Derek, and also the National Rural Employment Guarantee Program in Andhra Pradesh and Rajasthan has done well, and public distribution system has done well in several other states. But what are the important factors? As Ghana presentation mentioned, it's basically the political commitment, and the governance and the institutions play an important role in success of these programs in these states. So, but one cannot immediately replicate, because institutions may not be there in other states in the political commitment, but one can try these kind of things. So basically, to conclude, the puzzle of India is that economic growth is high, the poverty has declined, income poverty has declined, but malnutrition levels are stubborn. I mean, they have not declined, they have declined only marginally. And the agriculture growth and the malnutrition also, there is a disconnect, although we are yet to find out what is exactly happened. What are the factors? So maybe health factors or the women's well-being, other factors are important. But even the food interventions also were there for a long time. ICDS for last 30 years, 40 years there, still malnutrition levels have not declined. So it's basically one of the big lessons is what is this puzzle about the high economic growth and the high malnutrition levels. Thank you.